talking about how the healthcare sector is likely to change in the post-COVID scenario. So we are seeing some of the major changes from a regulatory and environmental changes perspective. So government, for example, approved teleconsultation. There have been gray areas around teleconsultation and e-pharmacy in the past. Government approved that at fairly quick speed during this time to make sure that that healthcare delivery was becoming easier and easier. And these things, of course, will become more and more prevalent. And the innovation in healthcare will be driven by many of these policy changes which are happening. Of course, home care became a critical part of it. I mean, if you see everywhere, home isolation, Delhi was a big success story. Arvind Kejriwal talked about it, who's the Chief Minister of Delhi. Our Prime Minister, Shri Narendra Modi, talked about home isolation. And this is something which has become, home care has become a key talking point in the healthcare ecosystem in this COVID scenario. And of course, as we have been managing with governments, working with governments to manage these COVID positive patients, other big change which we see happening is in the patient and customer behavior. So earlier, anything goes wrong health-wise always happens to our neighbor. It doesn't happen to us actually. And many of the younger people always believe they are immortal. But today, the focus on the health has changed a lot actually. The people, what they were looking at, preventive healthcare or the primary healthcare, both of those, chronic disease management, because in COVID, that if somebody has an existing lung disease or has an existing diabetes or any of the comorbidities, hypertension and all, there are more likely chances to catch it and more likely chances to have a severe case of COVID with you if you had any of those problems, existing chronic diseases. So patients' awareness to take care of their health is increasing multifold actually. And we are seeing that in our other offerings also, which we have for the patients. So we believe that focus on health is going to change tremendously. Focus on wellness is going to change tremendously. Focus on preventive care, focus on chronic disease management will change tremendously. Of course, customer behavior is changing. There's so much of work from home is happening. There's so much of technology uses which is happening now. So teleconsulting, point of care devices, those kind of things, the acceptance of that in the healthcare ecosystem is going to change tremendously. Corporates, for example, work from home is going to be the norm actually. So 25%, 50% of the people will work from home. So companies will look at how they can support their employees at home also. What we call medical rooms in corporates, there are medical rooms inside the premises, and then of course medical rooms, virtual medical rooms, which are available for people who are working from home. So we believe that whole ecosystem in terms of working remotely, being remotely connected, using technology, taking care of your health is going to change significantly. We already see that in the last 4 or 5 months, and we believe that it will increase more and more. The other healthcare ecosystem players like pharmaceutical companies, insurance companies, doctors, hospitals, each of those will look at how they can start supporting patients remotely. We had so many of requests from some of our pharmaceutical companies partners that how can we take care of their patients who would have gone to a hospital earlier, like a cancer patient or a patient who needs dialysis. All of them would have gone to hospitals or the centers for their medical support. We are looking at how we can do that at home. We have done so many chemo sessions at home in last few months because companies are looking at how they can support patients at home because they are very vulnerable in terms of going to outside and catching the infection. So that's something which is picking up, gaining ground in a big way. Other big change which happened is that IRDA basically approved, saying that all insurance companies were to cover COVID home care also as a couple of programs on COVID support, that is Kavach and COVID Suraksha. So those programs also cover home care. So if you look at from a home health care perspective, that's another major change because home care was not covered by insurance companies in the past. Now with this particular COVID care, the home care also is getting covered, at least COVID care is getting covered by insurance companies in their policies. And we believe that a lot more is possible to cover as we go along. So there's another major change which is going to happen, which is already in works now. We are supporting so many patients through our insurance partners at home for their COVID care. And we believe that that's something which again will be a very big change in the macroeconomic factor, as you could call. These are macro factors which are changing as far as healthcare is concerned and consumer behavior is concerned. Of course, the new healthcare dynamics, as I said, home care has moved from being nice to have to a must-have. Hospital, clinics, home care will complete the care continuum actually. So I mean, if you would have noticed, Apollo mentioned some time back that they are looking at roughly 50% of OPD consults to go in teleconsult in next 3 years. That's a really big change from a healthcare delivery perspective. What it allows or what it supports is that a lot of tier 3, tier 4 cities where such kind of, or villages where such kind of robust healthcare system or healthcare infrastructure is not available, could also avail the same level of healthcare services, leveraging the teleconsulting piece. So that's again a major change which is in the offering, which is already happening. Of course, hospitals can look at home care more robustly to continue with the care continuum. And of course, ecosystem players are going to leverage being connected to the patient in a remote way, in a big way in the coming few years. That's how we see it. So these are some of the new healthcare dynamics which we see are playing out now, and will continue to get built over a period of time. Other 2-3 areas which I believe will change significantly from a healthcare perspective. Community health will become much bigger. So if you look at elder care actually, so if you look at a lot of deaths which are happening in Italy and US and all, were all happening in the assisted living homes actually. So India, given that we have so much of elderly population who are staying at homes, not, and many of the people still stay with their families, how can you take care of elderly at home? How can you leverage community? India has a strong network of primary care centers. How can you work along with governments, leveraging those primary healthcare systems and primary healthcare center infrastructure to take care of the elderly in the community? So they don't necessarily go to the hospital or to the clinics, but the high quality healthcare comes to them at their doorstep wherever they are. And all the healthcare workers, ASHA workers, and everybody who's already in the ecosystem, how they can basically support these elderly in much stronger manner. Other area which we see tremendous opportunity and changes is from an infection control perspective. So a lot of patients who are getting an infection, should they go to a hospital, should they go to a clinic, or can they do a teleconsult, whether they do it with the hospital or do with a teleconsultation service provider. But the fact is that the infection management can be done in a more and more robust manner and a remote manner. So if you look at the new government guidelines and new government healthcare policy, infection control, infection management at the community level, at the district level, at the local level also is going to become significant. For each of those, you don't need to go to the hospital. So can you create infrastructure? Can you create network? Can you create expertise around infection management? That's another big area which we see will pick up once this whole COVID scare comes on. COVID itself is a like sort of infection, right? So the way COVID gets managed remotely, which we are able to demonstrate, and of course a lot of state governments are working on this now. Can other infections also be managed remotely as much as possible? So the way you see that test, track, and treat is something which you can do for any of the infections, any of the diseases like contagious diseases like that. So we believe that elder care, chronic disease management, preventive care, wellness, home care, of course, infection management, each of these areas, with the more use of technology, the more use of centralized expertise, the more use of managing this healthcare in a distributed manner in a community at a community level, will unfold in a very big way in India. So next 10 years, 20 years, healthcare is going to be a very big focus, because we have to catch up from an infrastructure perspective as well as readiness perspective on how to handle a pandemic of this nature if we were to recur, which, I mean, today we know that, okay, these kind of things are possible. So as we manage COVID as a country and get victory over it in next maybe few months, year or so, this also opens up completely new dynamics in the healthcare environment to create offerings to support patients in the easiest possible manner, leveraging technology. And tremendous business opportunities are available today to create new ideas and build on those ideas to support the patient. So I would stop at this. Are there any questions? I'll be happy to take.
Thank you, Vaibhav. So we have a question here from Pali. Are teleconsultations as effective as physical consultations? where a lot of tests or checks the doctor might have.
So I think teleconsultation in many of the cases is quite effective actually, and of course there's something which will be used more and more. So I think of course nothing is equivalent of a doctor seeing you in person, but I think teleconsultation is almost equally effective and is being used a lot in many cases already now.
Right? Currently operational and now.
We are working with almost 8 states right now as we speak.
The questions. How does the whole dialysis work, Vaibhav? Like for example, you said a lot of patients who are a little hesitant to go to the dialysis wards. How do you it happens smoothly?
So dialysis basically there's a partner called NephroPlus. We work with them basically, and there's a complete setup of equipment at the patient home, and it gets set up. And then of course, because dialysis you have to do 2 or 3 times in a week, so it is a fairly engaged process, and that's something which gets done along with the partner right now, and works quite effectively actually. They also launched dialysis on wheels actually. This is the mobile van which will come to your facility and do dialysis for you at home. So that's again something which is working well now actually. So some of these things which were only possible in a clinic or in a hospital setup earlier are being done at patient home quite successfully, and these will only grow. Of course, this will happen for some of the patients who are probably not as mobile as you would expect a normal patient to. So if you can go to the hospital, some of them may still go, but it's very, very useful for patients who are not very mobile.
Great. See, do you have any more questions? Also, so another focus area for Innopark Ventures is the field of medtech, and Portea Medical has now been in this field for, like you said, 7 years. What do you say is the scope? I mean, do you still think there's a lot of things that Portea Medical can cover of your business, improving or more new services that you could add?
I believe that, see, from our perspective, everything is built around a patient demand. Actually, I mean, we believe mental health is another area which is going to be very big in the country, right? So, I mean, can you support people? I mean, that has been a taboo in India in many ways, right? We don't talk about mental health, but that's another area which I believe is a tremendous need actually. And if we can find ways to take care of Indian consumers and in the way they think about it and how we basically support them, I think mental health is another big area to work on.
So is Portea Medical going to venture into that field also very
We are
soon?
looking at how to support patients, of course, very, very early stage. Yes, we are looking at that.
Great. So I think that's given an opportunity today because this being a our matchathon, which is like a much bigger event, we are inviting either various fields, medtech. So, any more questions?
I'd actually like to thank Vaibhav for bringing up the mental health issue. Vaibhav, most of the people we engage with are founders, entrepreneurs, student communities in the tech and engineering backgrounds. And obviously, they're subjected to severe pressure, whether one agrees or not. And it has been such a taboo. People write to us one-on-one saying, one of the biggest things is not even raising funds. It's just the day-to-day stress that we deal with. So we sincerely hope that Portea supports this and makes it sort of a non-taboo thing to pursue for anybody. It's as much as we take care of physical health, well-being, we must take care of our mental well-being. So thank you for bringing that up, and I hope we all hope that we see Portea's efforts towards that very soon in the market.
Yeah. Yeah, I mean, entrepreneurship, of course, has its own set of demands and challenges. So, of course, you build anything new ground up, it is like raising a new baby. And anybody who has been a mother or has been a father will know what it takes to build to basically grow up a baby. And companies are the same way, actually.
Right. So
Yep.
do we have any more? Sita, do you have any questions?
No, I think Vaibhav's nicely covered everything that I wanted to ask. In fact, I had a list prepared, and it was such a comprehensive and informative session that he walked us through that most of it has been answered. Let's ask the audience. And if the audience, Vaibhav, we will have this up on social media platforms. If there are any specific questions for you, we will collate them and Joanna will email them to you, so you can answer them, and we will also put up the answers on the social media platforms.
Sure, great.
Time today, Vaibhav.
Thank you. Thanks,
Pleasure
Vaibhav.
listening to
Thanks.
you today. And thanks.
Yeah.
Thank you everyone for joining today. It was really quite an informative one. Please log on to Portea and check out the services. I think that we did beneficial to everyone now. Thank you, everyone. Thank you, Vaibhav.
So thank
Thank
you,
you.
Vaibhav.
Day.
Thanks to
Thank
Portea
you.
for all the wonderful work. Thank you. Bye-bye.
Bye-bye.